Lipedema. Let's talk about it. So last week, I had a client that came in for lymphatic drainage treatment because they were diagnosed with a condition called lipedema, Lipedema, which might sound a lot like lymphedema, but they're different. So lipedema is talking about swelling that's happening in the adipose tissue. Like lipids are fats, so lipedema, swelling of the fat. So I have a few different resources here. The main reason I wanted to bring this up was simply to raise awareness. Apparently this is something that's relatively prolific, but isn't well known and is frequently misdiagnosed. I don't know all of the numbers and stats on that, but there's a few different resources that I'm going to share so that you guys can look into it, learn more about it, and potentially help somebody get some answers if they've been struggling for a while. So what is lipedema? How do they define it? So this comes from myclevelandclinic.org. I'll share the link, but from that source, they clarify that it's not lymphedema. It affects the buttocks, thighs, calves, and sometimes the upper arms, and there's different stages to it as well, and it can get progressively worse over time. It does not, however, cause swelling in the hands or the feet, which I thought was very interesting. So that's one thing that potentially separates it from something like lymphedema. Now, they did say that it may lead to lymphedema. So it may start as lipedema and then become lymphedema. They say that swimming, walking, cycling are effective to slow the fat accumulation. So it sounds like it doesn't correct it or fix it, so to speak. But there are things that people can do to help themselves out. Now, in some cases, a specific type of liposuction is indicated, as well as lymphatic drainage. And when I say specific type of liposuction, it is what they call a lymph-sparing liposuction. So they're careful not to damage any of the lymphatic connective tissue, sounds like. And then they also say that it almost exclusively affects women. So very rarely seen in men. Now, then from totallipedemacare.com, or TLC, which is where there's a couple of doctors that have paired together, and I believe they have others that are helping them as well. But a big name in this field that the client shared with me is Dr. Karen Herbst, who is an endocrinologist, who has partnered closely with Dr. Jamie Schwartz, or Jaime, I'm not sure how they pronounce it, and they're a plastic surgeon. And from their website, they say that the condition is caused by fluctuating hormones. It's typically seen as women enter their 30s, and diet and exercise do not combat the disorder. So really, really interesting stuff, because essentially the fat, the adipose, will begin to swell and accumulate more and more fluid, and despite the person's best efforts to exercise or diet themselves back down to a healthy weight, they can't do it. I don't remember where it said, like which website it said, but there was causes issues with the thyroid. So it can be something that is tricky to diagnose, or a doctor might just say, oh, it's obesity, so you need to diet and exercise, and if that doesn't work out, then it must be something you're not doing right. Now, I also found a scholarly article. There's I think it's called like Scholarly or something on Google Scholar, and you can look up various I'm struggling to think of the word, scholarly articles that you can find on all different kinds of topics. So this was just one that I found. I mainly read the abstract. I didn't read too much further, but I thought it gave a really nice, more of a clinical definition. So this is from NCBI. .nlm.nih.gov, so NCBI is what I'm going to call that for short, and I'm going to share the link to this as well. So I'm just going to read the whole abstract. I'm going to pause in certain times to explain what different words mean. So lipedema, or adiposis dolorosa, is a common adipose tissue disorder that is believed to affect nearly 11% of adult women worldwide. It is characterized most commonly by disproportionate adipocyte hypertrophy. So adipocyte, I believe that's a fat cell, and hypertrophy, that's overgrowth. So essentially the fat cells are overgrown, is what that is a literal translation for that. So adipocyte hypertrophy of the lower extremities, significant tenderness to palpation, and a failure to respond to extreme weight loss modalities. Women with lipedema report a rapid growth of the lipedema subcutaneous adipose tissue in the setting of stress, surgery, and or hormonal changes. Women with later stages of lipedema have a classic column leg appearance with masses of nodular fat, easy bruising, and pain. Despite this relatively common disease, there are few physicians who are aware of it. As a result, patients are often misdiagnosed with lifestyle-induced obesity and or lymphedema and subjected to unnecessary medical interventions and fat shaming. Diagnosis is largely clinical and based on criteria initially established in 1951. Treatment of lipedema is effective and includes lymphatic support such as complete decongestive therapy and specialized suction lipectomy to spare injury to lymphatic channels and remove the diseased lipedema fat. With an incidence that may affect nearly 1 in 9 adult women, it is important to generate appropriate awareness, conduct additional research, and identify better diagnostic and treatment modalities for lipedema so these women can obtain the care that they need and deserve. I find it interesting that they're including the realm of like the fat shaming or like kind of that undertone of judgment going on, and they did kind of go more into that in the paper. And I wonder how they would define fat shaming. It's a bit of a vague term. I think I would have preferred it if they'd focused more on just the science and the biology of it. Now, according to the biopsychosocial model, it is important to consider how clients and patients are spoken to in regards to their condition, and that you try to help the client maintain a healthy and positive self-image whenever possible. But the reality of things is the reality of things, and I think sometimes it can be almost a detriment or some form of denial. So, I mean, but I think what they're coming from is more like they're diagnosed as obese or, like they said, lifestyle induced, so they're doing the wrong things, and so it's their fault, so to speak. And so then when they come back to the doctors and say, I've tried your recommendations and it hasn't worked, that I guess there is a tendency for doctors to kind of furrow their brow and say, oh, well, you must be lying because there's no results, therefore, which is not okay. That's not okay. So I wanted to talk about this today and raise awareness, like I said. If you have clients that have hormone issues, maybe fluctuating or issues with their thyroid, they try to diet and exercise and like crazy, and they're just struggling and they just keep gaining weight no matter what they're doing, and they're very tender to palpation and they bruise easily. So once we get enough of those kind of check marks down the box, not that we're going to diagnose and say, you know what, I'll bet you have lipedema, and I wouldn't say that, but I might seek out professionals in your area that are familiar with lipedema cases or can competently diagnose a lipedema case and differentiate it from lymphedema or Derkham's, which is also closely related to this condition, but can differentiate between those things, or find somebody, the closest one that's available, so that if you have a client that kind of fits the bill, that you can say, I would be curious if you went in for an evaluation from Dr. So-and-so, and see if there might be something that, get a second opinion, a third opinion, a fourth opinion, whatever it is. But there's ways to have that conversation so that you don't cause unnecessary stress, but potentially lead them to some answers. So that was the main thing for today, was just about lipedema. So I'm curious if any of you guys have heard of this condition. I think I may have heard about it several months ago, but then when I got that client last week, I just thought, okay, I need to have a video about this. And they are going to some professionals in another town that's several hours away, but still in Texas, because that's the lengths that they have to go to in order to get proper treatment and care for this condition. So I thought it was really interesting. Like I said, the links to all these different websites are going to be available. I tried to have a kind of a nice smattering of things where, there's a clinic website, there's an abstract from a scholarly article, and a website from professionals that are actively treating this disease. That TLC website, totallipedemacare.com, it does have a questionnaire. There's a lot of information that people can read. So that's another possibility. If there's if the closest doctor is like hundreds of miles away, that could potentially differentiate between these, the Derkham's, lymphedema, lipedema, etc., that they could be referred to this website to read up on another potential thing, because there is a questionnaire there that asks you a lot of different questions, and do you believe you could have this or not, or who have you seen, kind of similar to the pain assessment and health history intake that we do as therapists, but just really specific to lipedema and things like that. So I hope this is helpful to you. Like I said, I'd really love to hear your thoughts on this, or if you've worked with lipedema cases before, and share any additional information that maybe I didn't touch on in this video. But I would really like to continue learning more about this condition as I continue to treat that client that saw me last week. So I hope all of you have a great day. If you haven't gotten that subscription to the website, I highly recommend it. We have those 4K technique videos that TC walks you through step by step all the different techniques that she teaches in class. And we also have the monthly MMP Zoom meetings where you can log in with TC and she'll be doing a case study or talking about something business related, and getting a lot of value out of that. So I'll see you next time. Thank you so much. Have a good day.